Coming up on Mayo Clinic Q&A.
Palliative care is an approach to care that really focuses on improving quality of life by managing symptoms that may come up from cancer or its treatment. And palliative care is really appropriate at any stage of cancer, whether it be diagnosis through treatment and beyond.
Palliative care is specialized medical care that focuses on providing patients relief from pain and other symptoms of a serious medical condition.
The goal of palliative care, along with helping patients manage their symptoms and improving quality of life, is really providing that support to their loved ones or their caregivers so that they have time to care for themselves, feel well supported so that they can continue to give to others.
Welcome everyone to Mayo Clinic Q&A. I'm Dee Stephens sitting in for Dr. Helena Gazelka. Palliative care is specialized medical care that focuses on providing patients relief from pain and other symptoms of serious illness, no matter the diagnosis or stage of the disease. When offered alongside cancer treatment, palliative care can help people with cancer manage symptoms and improve the quality of life for both patients and their families. Joining us to explain how palliative care is used for cancer patients is Mayo Clinic palliative medicine expert, Dr. Deirdre Pachman. Welcome to the program, Dr. Pachman. Thanks so much for joining us.
Yes, thank you. Thank you for having me.
Well, first off, there can be a lot of confusion for people about palliative care versus hospice care. So how do they differ?
Yeah, absolutely. This is a really common question that we get from patients. And so palliative care is an approach to care that really focuses on improving quality of life by managing symptoms that may come up from cancer or its treatment. And palliative care is really appropriate at any stage of cancer, whether it be diagnosis through treatment and beyond. Hospice is a more specific type of palliative care. It also focuses on quality of life and improving symptoms, but hospice care tends to get more involved when someone may no longer be getting treatment directed at the cancer, or if there's a more limited life expectancy.
So could you talk a little bit more about what role palliative care plays in the treatment of people with cancer? What types of support and services might be offered?
Yeah. Well, when somebody has cancer, they can have multiple symptoms associated with the cancer or its treatment. They might be physical symptoms like pain or nausea or fatigue or other emotional or social or spiritual needs. And the palliative care team really focuses on addressing these symptoms and these needs so that we can help people feel as comfortable as they can as they go through their treatment for cancer. Um, we do this by focusing and talking about some different interventions. They might be medications or they might be other procedures for pain that some of our colleagues do. Palliative care is a very team-based approach too. So we may involve our nurses or social workers or chaplains really to all be there to help support the patient and make sure that we're addressing their symptoms and their needs. And, some of these services might be through the palliative care team and others may be through our other colleagues, such as pain specialists or physical therapy or things like that.
So how do physicians decide if a person with cancer needs or should get palliative care?
Yeah. Well, ideally, palliative care can be involved as early as needed in the cancer treatment process and really be involved throughout other stages of cancer. Some oncologists may recommend a palliative care referral at diagnosis, and others maybe when somebody has more symptoms or difficult to treat symptoms. So really, palliative care can be another layer supported at any stage for a patient who has cancer. We tend, though, to see patients who may have more advanced cancer or patients who have symptoms related to the cancer or its treatment that need some help with that.
Okay, that makes sense. And is this something all cancer care providers offer or just some?
Yeah, so all cancer care providers can manage symptoms associated with cancer and its treatment and care about the comfort of their patients. But palliative care specialists have a little more training in symptom management and in helping patients, families, and caregivers cope with serious illness.
So what can people with cancer expect from palliative care?
Well, when a patient is seen in palliative care, they can expect a comprehensive assessment of their symptoms and their needs, and they can expect that we'll work together as we think of a treatment plan that can best address these symptoms and needs. Again, they can expect that there may be a team involved in that, nurses, social workers, chaplains, really all to make sure that we're working together. And they can expect that the palliative care provider is working closely with their oncologist so that we're all on the same page and working together to make sure that we're addressing those symptoms and providing that extra support.
That's got to be comforting to have sort of that team approach around you. What are the types of questions people should be asking their care teams about palliative care?
No, I think asking their care teams if there are palliative care services available to them, and if there are, then they can directly, ask for a referral to involve palliative care in their team.
And we talked a little bit earlier about not just the patient, but the families and the caregivers of the patient. So what can the caregivers of people with cancer, what should they know? What can they expect? How can it help families?
Yeah. Well, I think one is just recognizing how cancer doesn't just affect the person who has it, but all the people around them. And palliative care teams do have training and helping support families and caregivers and make sure that they get to the resources that would be most helpful for them. The goal of palliative care, along with helping patients manage their symptoms and improving quality of life, is really providing that support to their loved ones or their caregivers so that they have time to care for themselves, feel well supported so that they can continue to give to others.
Wonderful. Is there anything else that you'd like to add? Anything else you think people should know?
I think just to reiterate that, palliative care is another layer of support for patients as they go through their process with cancer, and that involving palliative care doesn't mean stopping treatment or changing that cancer treatment, but just having that extra support, and that palliative care really can be considered part of the cancer care team.
Perfect. Well, our thanks to Mayo Clinic palliative care medicine expert, Dr. Deirdre Pachman, for being here today to discuss how palliative care resources can help patients with cancer. Thank you so much for your time. This was a great discussion.
Thank you.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a